One of the difficulties that we find with our students coming to the United States is the expectation of how the patient presentations are made and how the notes are written. And so today's presentation was really focusing on detailed types of presentations, how to present a very focused patient presentation versus a longer one, and as well as different types of notes and the reasons for those notes that we write. The main questions were about really the most important parts of the presentations, how to focus the presentation on a relevant piece of clinical information and how to present the clinical information to support the patient treatment and advocacy for the patient through these two different techniques of oral presentation and written.
Advantage of our program, USMD program, is exactly like individual working style of the students with the patients and their presentation. Exactly, this was the key points of our meeting today, and our guests shared experience about presentations, about some details that will be very nice for our experience in the future.
For us, it's very important to understand how it is done in the United States, to teach students and for them to make more precise notes, to present patient in different manner. This is at bedside when you have just maybe several minutes to present, to how to call some consultant and tell them what's happening with this patient. At that moment you have even less time, how to present during rounds when maybe you have much more time. So, and what to emphasize, what is important, what you need to talk about first, and then later what you need to give other information. So today's presentation and training, let's say, it was really wonderful for me especially. So I'm doing this with my students, but I think I have too many new ideas how to do it much more better. And why it's important, because here we're all representatives from almost all clerkships, and slightly differently we were doing this. Now I think that we will do it in the same manner, and it will be very useful for our program and our students.